Well, good afternoon, everybody. I'm Dr. Heather Herdman, and with me, as you all know, is Dr. Dorothy Jones. Just a couple of things before we get started here. We are recording this video call so that we can put it up on our YouTube channel later for people who aren't able to join us right now. And also we have a Q&A button at the bottom of your screens. So if you have questions or comments or anything you'd like to share, please feel free to type it in there, and we'll be monitoring that, and we'll be happy to try to answer your questions. Okay. So the purpose of today really was to start to get us excited about the fact that we are entering into our 50th year as an organization, as a movement, you could say, within the nursing profession, and to kind of take a little bit of a look backwards at the last 50 years of the association and conferences, and then to begin to take a look forward into what's going to be happening this year. And we're very excited about this year's program. So with that in mind, I'm gonna ask Dr. Jones to start us off here by talking a little bit about, the first conferences and thinking about what were the mandates or the primary purposes for having those conferences when Marianne Lavin and Christine Gebbe first pulled them together.
Thanks, Heather, and thank you everyone for joining us on this webinar. It's so nice to see everybody, even though I can't see you in person. I know you're there. You may recall at the beginning of this whole endeavor was precipitated by convening a meeting in St. Louis. And Christine and Marianne both brought that together. And it was really a notice. I remember when I first began teaching at Boston University, there was a notice that came out to all of the universities indicating that this big meeting was happening in St. Louis, and it was really exciting, and it was all about language and nursing and communicating our science and our discipline and our work in the practice environment. And I remember one of the people from Boston University, Stephanie Clatworthy, was a representative to this group. And I wondered, well, how in the world could you ever get involved in it? But I had just gotten myself a teaching position after my graduate education, and I was barely able to manage that. So this was in the back of my mind. But anyhow, they convened this meeting. And if you read the literature, you see that the real challenge was they were working with patients in an acute care environment, involved intensive care, et cetera. And particularly with cardiovascular patients, they were really wondering how they could get language that really was reflective of the work of nursing, and to look at documentation of all of the things that were happening, not only the monitoring and surveillance, but attention to the depth and breadth of detail that went on with the patients they were caring for. And they felt that this was pretty much a pervasive problem, and that the electronic systems that were available certainly weren't capturing nursing knowledge, nursing work. And so they embarked on this convening of a large group, which involved both academic and clinical people, had administrative people involved from both the academic world and the practice environment, and looked at really trying to bring in the leaders of the field over time, increasing, for example, a nurse theorist group, and bringing them together so that it could really be grounded in the work that was being done, could be clearly grounded in nursing knowledge. One thing that was always funny to me was when I did get involved with NANDA, that kind of followed my trajectory from BU to Boston College, where Marjorie Gordon was a faculty member and professor of nursing. And she hired me one day and then gave me my membership application the next day for NANDA. And so ever since the late 1970s, I have been an active participant in this group. One thing that always struck me about a NANDA conference, particularly the early days when we went to St. Louis, was there were never enough rooms. And many people would sit in the lobby with their bags waiting for rooms to happen, never did. And we always underestimated, I think, the number of people that would be attending these conferences. And in St. Louis, I can remember when we had it at the big hotels with the trains within the train station, it got to over 800 people that were attending these conferences. So it was a large group of people from within the United States and within Canada primarily. And then more groups became involved, particularly in Brazil and Spain, and representation through a lot of these countries, and Japan. A lot of countries developed their own internal representation and groups that met on the state level in New York, in Washington, California, Michigan, all around the United States. So it just increased the number of people in attendance. And gradually, some of this has dissipated in the United States and increased globally. And the need and the mandate for the first conference prevails. We still are challenged by, capturing nursing in the presence of a patient environment, capturing all of the work that nurses do in relation to the patient outcomes, looking at, the innovation that's going on in the practice environment with nursing and nursing science, and trying to make sure that that's effectively communicated, but still trying to bridge the gap between the work of nursing and the monitoring and surveillance that goes on around people and their illness, and then thinking about their health experience or their wellness experience and their response to illness and how they live everyday lives and how nursing is communicating that. I think the early days prevailed, presented us with an opportunity which has continued to prevail throughout all the conferences, and that has been the fellowship of people coming together, the networking, the continued communication, the extensive publication and presentations that have gone on globally, the introduction of many new people to the world of nursing language standardization and information systems. But they still have the prevailing challenges also of generic acceptance of this worldwide, and having the work of NANDA and of NIC and of NOC and clearly disseminated in a way that is representative of all nurses. Subsequent conferences went from St. Louis to around actually the globe, but San Diego, California, and we had conferences in Spain, in Madrid. We had conferences in Boston before. But it kind of traveled around the world, and challenges occurred, but also a lot of fun. Setting up the conferences in any state that you went to was always a challenge in terms of commuting all of the material back and forth and making sure that we had enough t-shirts and we had enough booklets, and this was not the day where things could be sent to people on email and they could come to the conference with everything. These were the days when you had to prepare everything ahead of time. So we had a massive force of people that were always in attendance to help with that. And we're hoping that this time, as we convene in Boston and begin to gain greater knowledge and listen to more depth in terms of helping us move this whole idea of standardized language into the global network, that you'll be inspired by a lot of people who have done really great work, and you'll be challenged by some of the issues that still prevail. And we're looking for solutions to kind of solve them with leaders from around the world, bringing their knowledge and bringing their expertise. But hopefully there'll always be the networking and the friendship and the reuniting of people that has happened at every conference, and give you an opportunity to meet with each other, talk with each other. And, a lot of people who have come to these conferences have done research together, have put programs together, written books together, done publications together, gotten grants together. So I think this is an opportunity for you to grow, not only in the work that's going on within NANDA and standardized language, but also advance your own professional career and your interests in terms of research and development. So welcome.
You know, it reminds me, Dottie, of my first conference, which was in 1988. And I was a grad student also who was handed my membership application by Marge Gordon. um, and I remember going and I think I was sitting in between the two of you. And as people were filing into the room, you're saying, oh, there's Kay Avant. Oh, there's, Gloria Bulachek. Oh, there's Linda Carpenito. When I came home, I remember I was talking about the conference and one of my friends said, it's like you just met all the gods of nursing in one room. And that's how I always feel when I go to a NANDA conference. The really great thing for me is that those gods have expanded to be, people from all different countries too. So they're not just the American leaders, they're, all over the world. And that's really fascinating to me. And to see how different levels of practice are expressed by language is also very interesting, because you'll hear conversations at the conferences where someone will say, oh, well, that's not nursing in my country. And then somebody will say, well, that's very much nursing in my country. And those conversations, I think, are very eye-opening, because it kind of lets you look at the expanse of nursing practice across the globe and think about, does that make sense within my own practice or doesn't it? So there's always enlightening conversations, I think, that take place from that perspective as well.
Yeah. And I think also the building of the NANDA board, when we first started, and how that board functioned, and now how it functions, and the leadership of these committees and by directors taking on a lot of responsibility, particularly as a volunteer organization for the most part, and able to function globally with, a site designated, but then multiple arms. So the outreaching and obviously the advantage of the electronic era has permitted the outreach of nursing and nursing languages, and certainly the work of NANDA, to occur on a regular basis. I mean, if you think about the abstracts that some of you might have submitted, I mean, that went from Boston to Portugal to many people from around the world who served as reviewers, back to Portugal again, and back to Boston to send out the letters. So, I mean, it's when you think about it, it's now such an enterprise in its own right, because of the many people, but also the strategic, technological kinds of things that are available to us to allow for that communication to occur. And so talking with you today and giving many people an opportunity to hear not only about the substance of the conference, but just to the engagement, I think is pretty profound.
Yeah. So as you look back on the last 50 years, are there a couple memories or things that happened at conferences that kind of stick out for you that you would think of as kind of like the penultimate conference?
Well, I mean, I remember things like Phyllis Critic, being the chair of taxonomy when we introduced the first taxonomy. And I also remember the theory group presenting their ideas, led by Martha Rogers, on the structure of the taxonomy. And those were wild meetings. And everybody always had an opinion, whether it was just about a diagnosis or the structure, the definitions, the assessment, the content, and everybody wanted the language to represent their practice. So trying to come to consensus was a challenge. And the second major piece, I think, had to do with the communication of what was happening. So the books that were developed became like the Bibles for students, pocket books and, large tomes of things that were written, but then a lot of people integrating this work into major textbooks in major specialties. I was the chair of, well, first of all, I joined the publication committee when Chris Gebbe was president or director or chair of it, I guess at that time. And then she left that committee and I became the chair of it. And that's when we went out and got bids for the journal. So the first journal came out when I was working with the publications committee. And then we hired Rosemary Carroll Johnson to take on the lead of that. And that was a very special time as well, because that accelerated the ability for NANDA to communicate its work, but also gave authors from around the world an opportunity to this day of sharing their work. So that was another big initiative. And then probably looking at, the evolution of informatics and information systems and technology, and the translation of the work internationally. So you had multiple versions of what was being done, communicated around the world based on, what was happening at the core of NANDA. So the dissemination of that information has just exploded. And then the people doing their own work in their own countries and communicate what was happening. So, I mean, we went from, the taxonomy and the consensus taxonomy, then, the communication, the role of knowledge, nursing knowledge. And then I think the other big thing is the evidence-driven practice, and how evidence has become core to the development of nursing diagnosis and the sustainability of use of nursing diagnosis over time. And, the value of a standardized assessment still looms overhead, because within the assessment comes the evidence to both generate as well as evaluate. And that's still something that we're dealing with.
Yeah. When you talk about evidence, it makes me think about when I think about those first conferences where I kind of sat in awe of everybody who was in the room. One of my favorite things was to hear people, I always felt kind of bad for whoever was in charge of DDC at the time, the Diagnosis Development Committee, because they would present a diagnosis and then mayhem would develop on the floor, and you'd have people who were for the diagnosis and people who were against the diagnosis. And there was a lot of passion, and you would hear some really good perspectives on why you might want a diagnosis or not. And part of me misses that passion. And yet, we now have such a rigorous, evidence-based process that's no longer really appropriate to have that kind of discussion, because just because I wouldn't use it in my practice doesn't mean it's not appropriate for practice. So but yet there was that passionate engagement of members into whether or not something was a diagnosis or wasn't a diagnosis. And so I think if we look forward and think about this year's conference, there's going to be some opportunity for some passion, for some discussion.
Yeah. But I think that, we went from a consensus building group, which was like the lowest form of evidence, to really the rigor of, well, not standardized trial, but, getting close to research that grounds the work. So it's not just a guess or a group of people saying it was a good idea. And that's really become very important. I think the other thing too was, in addition to the nurse theorist, there was a lot of philosophical discussion. And, Phyllis Critic led that initiative, I think, a lot. But then we had people like James and Dickoff and other people come relating nursing language to philosophical underpinnings around decision-making, inquiry, intuitive knowing, all of those concepts that were out there as well, kind of suggesting that this was a very cognitive process and that it was very substantive, and that the content that was embedded in nursing language was really emerging as the content of the discipline, concepts at least, that could be useful to experience what was happening with the patient. And then also the introduction of the theories in the 70s, just kind of moving forward and looking at the relationship of generic concepts to concepts that were really in a lot of these theories, like the Roy model. And Rogers had a little bit of trouble, but then she created that great classification system of knowing and all the ing words in the early days. So a lot of it had a lot of value to it in terms of being linked to the knowledge of the discipline.
Yeah. So should we talk a little bit about this year's conference and what the themes are?
Yeah, Sure. So I mean, I think that this year's conference, people submitted abstracts in the area of new knowledge, of education and how they taught nursing diagnosis. They thought about the research that was going on, the introduction of some of this work in terms of information systems and, validation and testing and variety of settings, and impact some have had on policy within the organization and outside of the organization. We also want to bring people up to date in areas that they may want more intensity. And so the pre-conferences that are going to be available have also provided a framework for people who may feel they just wanted more information about something. And some of them will be given one will be given in Spanish and one will be given in Portuguese, and then the same two will be given in English. But I think that, we're really trying to respect the legacy of the 50th anniversary. And not only to do that at one point in time, but to do it throughout the conference. We're hoping to have archival displays. And for people who don't know, NANDA Archives is housed in BC. And through your efforts and some of the work that we've been doing, we now have more things digitalized and available to people. So we're meeting with the librarians so we can make sure that these resources are available to people and people are aware of what's in the archives in case they want to do some work personally, but also if they want to retrieve documents now, they're more accessible. We have a lot of photographs and video contact material that we're going to be looking at and editing and putting in throughout the conference so that people will have a chance to witness some of these names that you've been talking about, but legacy leaders really, and different types of recognition and awards and things like that that are historic throughout the conference will go on. We have, so the first day dedicated in the morning really to legacy, the whole idea of legacy and legacy leaders, and have 4 past presidents that will be presenting some reflections on NANDA's history and during their period as president, kind of talking about highlights of things that might have gone on. I think we have throughout the conference tried to locate it in a place that people will have easy access to breakout rooms, easy access to food and break sessions throughout the conference, and also any kind of sponsorship that will be available. People have easy access to that. They will be able to eat outside, hopefully, if it doesn't rain, and then inside as well. There'll be plenty of space for movement. We actually are going to be having this at the Rob Sham Theater on the Boston College campus, which will be pretty accessible to everyone. And with the exception of one event, which is the main gala celebration on Thursday night, all the other events will be housed in that section. We have a number of scientific sessions that will go on throughout the conference, and we sent out letters notifying people who've had their papers accepted, and we're sending out notices. They may all be out now on poster. They've gotten the notice about poster, but more detail and how posters will be presented. We're looking for some type of recognition and acknowledgement of those posters and papers that were distinguished, and you can say more about that. We have an important presentation that will be going on the first night. There'll be a cocktail hour, and we'll have a chance to do some awards and recognition that night. The second day, we have a keynote presentation, and it will be going talking about informatics and information systems and knowledge with the inclusion of nursing language. And that will be given by Dr. Kenneth Cato from Columbia University, who's done a significant amount of work on this area. And that will be followed by a panel of distinguished leaders in information systems. And they will have reaction to what he's saying and talk about some of the issues and concerns that really are reflecting their own work and whether or not that can be brought to bear into some of the discussion as well. The second day, there's more scientific sessions and opportunity for the afternoon then to focus on and the morning session, there'll be the Gordon Scholars Program, scholars from that program around the world coming to speak about their experience as a Gordon Scholar and also talk about the integration of their work into the knowledge base of nursing, as well as contributing to the advancement of nursing diagnosis in particular, and talking a little bit about its usefulness within a variety of practice and education environments. In the afternoon, and you may want to talk a little bit about this, Heather, you will be introducing a session that talks a little bit about some of the updates and changes in the new book that's coming out, and that will be followed by the director of the Diagnosis Development Committee, Camila Tacos Lopez. No.
Nicole Lopez.
Yeah, that's right. Yeah. I have done Lopez and okay, and she will be talking about diagnosis development per se, but you may want to talk a little bit about your session.
Sure. So there's some major changes coming from a taxonomic standpoint. Part of what we are responsible for doing as an organization is making sure that we are consistent with international standards. And the International Standards Organization, or known as ISO, has a model for nursing diagnoses. It is currently in redevelopment. And we have seen the draft of the changes. And so we have been working very hard over a period of many months with people who are involved in taxonomic development, people who are informaticists, as well as those of us in the DDC realm of things, our informatics people, to bring our axes in line with the ISO model for nursing diagnoses. So there will be some substantial changes to our axes, both in terms of what the axes are and in terms of the actual terms within those axes. To be taxonomically sound, there cannot be overlap between one axis and another. So a term can't live in two axes. And you can't have terms within the same axes that are inclusive of one another. So as an example, we can't have bowel and gastrointestinal tract as an anatomical location, because the bowel is located within the gastrointestinal tract. So we have to make a decision as to what level of granularity we want to use within our axes so that those terms don't overlap. And then we have to look at how the axes relate to the actual label itself. And that's the most interesting part of this work for me, has been learning that the axes don't have to, every term in the axes doesn't have to be in the label. You can use axes terms from an informatics perspective to represent a label, but you don't have to have all the terms in the label. So we'll be talking about that and hopefully making that clearer. And then the other part that's really exciting is Dr. Silvia Caldeira from Portugal is the director of research, and her team has been tasked with a huge, huge task, which is to take every single diagnosis that we currently have in the terminology, in the classification, and re-slot it into our new level of evidence criteria. And so that is going to be a substantial change as well. So Dr. Caldeira will talk a lot about what happened, how things have been reallocated based on the new level of evidence criteria. And that, I think, will be really helpful for researchers in particular, because it will very clearly articulate the gaps. the former level of evidence criteria, they were good, but these actually are developed in a way that clearly delineates, to get to the next level, this is the type of research you need to do. So if you have somebody who wants to do a career trajectory looking at certain diagnoses over time, you know, over their history or over their career, there's a clear guideline for how do you move along that trajectory to keep moving the level of evidence higher and higher. So Sylvia and her group will talk about that and kind of try to answer questions related to that. So it should be a good session, but it will be a lot of new things. So we're anticipating that there'll be some questions, some concerns. I think the number of judgment terms, for example, has decreased by 2/3, because as we looked at some of those judgment terms, and I can tell you that one of the biggest questions I get from our translators every year when we go to translate the classification is, what's the difference between impaired and decreased? What's the difference between this term and that term? And often they're synonyms of one another. And so we have worked very hard to eliminate synonyms. I met with Karen Dunn Lopez of Iowa and Dr. Gail Keenan from Florida early on in this project and said, what do you all think about this? And they just kind of laughed. You know, they said, you know, what do these terms mean? How do we know one is different from the other? You really have to, you know, get these down to where they are clearly differentiable. And it takes me back to one of the German translation group meetings that we had. And I will never forget this as long as I live. Somebody saying to me, what is the difference between lack? When you say lack, does it mean less than or not enough of something, or does it mean none? And my answer was yes. and their response was, that's impossible. Those are two different words. And English can be very, you know, vague at times. And so this work has been really focused on trying to make our work much more clear, much more specific, and having, you know, someone from Japan, people from Brazil, people from Portugal, people from Germany, people from Austria, Italy, involved in these discussions, Ecuador, Mexico. It's very, very interesting because when there's translation issues with one language, there's often translation issues with multiple languages. And so it helps us to clean up the source language, which is English, to make it clearer so that then it's clearer for everybody else. So should be some good conversations.
It should really be. And there'll be a scientific session in between, but usually Thursday night, the second night of the conference, is when there's a lot of celebrations. And one will be the induction of new fellows, and there'll be information coming out about that. But the induction of new fellows into NANDA-I, and that's a big celebration. And then our dinner, and hopefully some surprises there, and give you a chance for fellowship and kind of let the fuse out for the day and just enjoy each other and get ready for the last day of the conference. One of the things that we want to do is look at the whole idea of magnet and magnet accreditation. And now many of you are aware magnet is international, and it's a process that has been interfaced with a lot of languages other than NANDA, NIC or NOC, into more of the international languages and classification systems. So there's a lot of questions about that, but magnet was something that came out of the American Nurses Association. It's part of a credentialing mechanism, but it really, bottom line, attests to the quality of nursing care within an organization. And there are over 400 hospitals in the United States who have received magnet designation. And there are many things that people have to go through in order to achieve it. but one whole big area is that of evidence and sustaining changes in practice over time with data and with evidence that kind of speaks to all of that evolution. The integration of standardized language into documentation systems around the United States in particular, where this has lived for many years, is very varied. And so there's many different forms of evaluating how effective nursing is through evidence-based types of studies and practices, through research and information that has become part of the documentation in terms of best practices, research in terms of new evidence that and how that evidence is being translated into the practice environment. But since it's moved into the international community, we have hospitals around the world seeking magnet designation, and we'll have a representative from Brazil speak to us, as well as the deputy from Magnet, deputy administrator from Magnet, and one of the evaluators who travels globally, who will be speaking about what criteria they look for, what do they look for in terms of evidence, and all of them have been asked to speak to the valuing and talking about increasing use of nursing languages as a really important component of standardization, of documentation, and of visibility for the presence of nursing. So that's a big discussion. Rebecca
Greystone.
What I keep calling her Greenwood.
Greystone.
Rebecca Greystone from ANA credentialing will be with us, and I think her presentation will be very stimulating, but then the exemplars that are provided for you in terms of how people get on the magnet journey, how they look at the processing, recognizing that it takes a long time to achieve this, and then reevaluation every 4 years. So it's not just you get it and it stays put, but in fact, you have to be recertified. So how that will happen and how that can be achieved will also be discussed. And then what different sites go through in order to achieve magnet, and the commitment of the whole organization to make that happen. We have a site in Spain that's moving towards this. We've had other sites that have gotten accreditation. Some have not received it a second time. Other people have moved forward with this, but it's a much more aggressive move to achieve that now. There will be a business meeting, which will update everybody on a lot of the changes that have been going on in terms of board members, outreach, what kinds of activities are going on in relation to the total board, and how people are moving some of the items that have been asked for by members in integrating them into the work of these committees. And you'll hear a lot of discussion about that. Again, you know, throughout the meetings, there will be these scientific sessions where we'll have an opportunity to hear from colleagues. The afternoon will be a special convening of the board to talk about strategic direction and talk about some of the ideas that are coming to the fore to follow through for members, and outreach to members with different groupings, et cetera, internationally. And the president will speak to that. And we will have an envelope paper by the president-elect, Dr. Laura Rossi, and then a closing of the day on Friday. And I think people will be energized, invigorated. Boston College campus is a beautiful area. It's in Boston and easily accessible to downtown for people who come earlier or want to stay a little later. It has many opportunities for cultural activities, as well as different things that will be ongoing on campus. And depending on where your housing is and where you choose to stay, there'll be activities probably all over throughout the days and evenings of the conference. The only other change in rooms will be moving to the alumni room in the a new building down on campus, a short walk from where we are now, where we'll be staying either on campus or off campus, but a short walk, and it's a large space, so we can accommodate people and have a lot of activities. There'll be a served dinner at that time, and again, a lot of recognitions that will go on and different things by people. So I think that, you know, in thinking about our legacy, the conference builds upon that and attempts to kind of demonstrate all of the changes that have gone over time. We will have materials available for you to see, letters, originating work, subsequent work. The archives are available for people to go to. We have access, if people so choose, to the course that has been created on nursing diagnosis, and more information about that in terms of how you can get access to that when you go home. There'll be opportunities to purchase books at the site if you so choose. We'll have a discount for the actual bookstore, of which there are several, which you can avail yourself to, and think about some of the reading material that will be distributed for you to use, and other things that, you know, we haven't even planned yet, but they're in the workings.
I think it's important to say too that registration is open. We've had people registering already for the conference. You can get to the registration either directly through the NANDA International website. You can also get there through the Boston College Marjorie Gordon program site. Either way, but if you go to our site, look at the conference, click on it, it's going to take you to that site for registration. You register for the conference first, then you will get an email back asking you about what you would like to do for lodging. And I think this is an important thing to note. There are two lodging options. One is on campus, one is off. The off campus is a hotel that is an easy walk to campus. It's about a mile at the most walk around the reservoir, which is, when it's a pretty day, it's a beautiful walk. But I will tell you, most of us stayed on campus last time and we really enjoyed it. These dorms are not the dorms that I grew up with. These are kind of like really nice hotel rooms. You have the opportunity then to kind of hang out with each other. It became kind of a community within the dormitory room, or the dormitory building.
Suite. It's a suite.
Yeah, you know, we had, you know, Linda Carpenito was serving coffee in the morning, and somebody else's room was serving, you know, wine at night. So people were just kind of wandering around the hallways, you know, talking to each other and getting into really good conversations. So there is an option for you to do that as well. If you have any questions about the registration, you can always reach out to us, and there is information on how to do that as well. And I did have a question that came through about the number of countries like who comes to these conferences, which countries come. And last year, or sorry, at our last face-to-face conference, which was at Boston, we had representatives from 22 nations. 22 nations. So that's a lot. That's great.
Yeah.
We'd like to beat that this year. But so, you know, we obviously don't have people who speak all 22 languages, but we do our best to try to, you know, help as we can. We do have translation of the major
Main sessions.
Thank you. Main sessions will be in Spanish, and possibly will be in Portuguese, depending on registration numbers. So we will have that. And I think that, you know, that's the best that we can do at this point. But we generally are able to, you know, find somebody else who speaks a language if you have difficulty, who can help us if there's a question that we can't answer. So we really work hard to help those of you who are not native English speakers to have the best experience that you can at the conference. And we get very, very positive feedback on that. So I don't think that you should let that dissuade you in any way. And as Dottie said, the pre-conferences, one will be done in English and Spanish, one will be done in English and Portuguese. So that's, that's a really good thing. The other comment
if
that I
I
wanted,
could-
oh yeah, go ahead.
If I
Sorry.
could just go back to the housing
Mm.
and registration. So there are deadlines for the early registration and they're designated June, I think it's June 1st, I believe it is. And there's designations for returning information related to the poster sessions and information about whether or not you're coming for the presentations if you're doing an oral podium presentation. Also, the housing in the hotel has been discounted, and there's a block of rooms available. But the rooms obviously in on campus are less. And just to kind of tell you, they're suites and they have a living room, a dining room, or dining area. They have a lavatory in the suite, and then there's usually about 3 bedrooms in there. They can have double occupancy or single occupancy, and that's spelled out in the information that's available when you select your room. And there's also options to talk, if there are people you want to be with and all of that. And so when you think about where you're staying in the hotel versus on campus, just reinforce that it's like a hotel, and there's a major cafeteria right across the street. So you wanted breakfast, you could get it right there. But there will be breakfast and lunch and food at nighttime, and a major dinner throughout the conference. There'll be breaks, there'll be water, there'll be different things that people may need throughout the day. Total availability right next door to a cafeteria as well. But then within probably, I don't know, a couple 100 feet, there are all kinds of little stores. There's an ice cream store, there's a sandwich store, there's a pizza shop, there's a little, store that you can buy supplies in if you need them. And like I said, the train, or the train, to Boston is right there, the Commonwealth Avenue line. It's right there. If people want a church, there's a church there, accessible Catholic church on campus. People have asked me that. And if anybody's on the line that is driving, there will be discounted parking on campus in a garage that's right within short walking distance of where the Rob Sham Theater will be.
Yeah, and thanks, Dottie. I really do encourage you to think about the dormitory. I think it's great. The other question that came through just was a comment really about the taxonomy changes because of the ISO model, or the access changes because of the ISO model, and then also the connection to SNOMED CT and how important that is in the European Union, especially because of the European health data space that's being discussed. And yes, we are also we work very closely with SNOMED CT. We have had 2 years of meetings with them. It is an interesting hierarchical organization to work with. And so just to let those of you know who are interested in SNOMED and who do have a connection with SNOMED, meaning that your countries are using SNOMED, it is really important that you reach out to SNOMED as well as member organizations, so as member countries, and tell them how important it is for you to have NANDA terms available, because they have integrated ICNP, and the person who is in charge of the nursing language set is not a nurse. She's a physical therapist, and she says to me every time I talk to her, I don't understand why you can't just be happy with ICNP. Why do you need something else? Why can't you just have one language? This is ridiculous. And so we really have to keep going back and going back and going back. And, and then she said, if this is so important, we need to hear from the countries. So we need to hear from nurses in our country, in the SNOMED CT countries, that you're looking for NANDA terms. So we're going to talk about that at the conference too.
I guess, if there are any questions that people have about what we've been talking about, or anything that you think other people would like to hear, maybe you could just put your questions in the chat at this time. I don't know if there are any.
I've answered the two that have come
Okay.
through.
Okay.
So,
One other thing might be people wanting to know how to get from the airports and the bus stations to Boston College campus, and all of that material will be coming ahead of time. And we will give you train lines, etc. There is train service that you can access at the airport and at the trains and bus stations that would bring you right to Boston College. But we're going to put all that information on a handout for you. We'll also have copies of restaurants and other things local in the area. Just want to remind people that all of the information about the conference, the schedule, the plan, who's speaking when, etc., as well as a book of abstracts of all the abstract presentations, as well as all of the posters that will go with people providing poster sessions or providing posters. There won't be any open sessions per se, will be handed to you and given to you before you come to the conference. And you can choose how much or how little you want to print out. You could download it and have it as on your computer and access that information directly. But you'll be well prepared to know what's coming, and we will have, material to give you there and bags and that kind of thing, but it would just be one less thing. If you don't feel like bringing everything with you, there are other mechanisms for you to download that. But just to be aware of that. And the business meeting information will come out ahead of time, as well as the book of information about that, where book of reports from all of the committees. So you'll be able to get an update on what's happening. We would have additional copies there if people need it, but all of that information will be given to you ahead of time. And I don't know, Heather, is there anything about bylaws or anything that you wanted to talk about?
There are some bylaws changes that have been recommended. So for members, those will be being posted soon. They're with the bylaws committee right now. Dr. Pauline Green is the chair of that committee. And so when she will submit those changes to us for posting. And just as with elections, which are up right now. So elections for board members are up. They will be posted for 60 days online, and then there will be 30 days for voting. The same thing will be true with bylaws. They will be posted for 60 days and then 30 days for voting. So keep an eye out. We'll announce that in the newsletter. It'll be on our social media as well when that goes live. But you should be taking a look at our nominations page, because there are people there.
Also, membership, if people want to, you might want to speak to that. We do people to get certain rates for the conference.
Yeah, there's discounted rates, significantly discounted rates for members. So it's a good time to do your membership as well as your conference registration. So there is a question, Dottie, which is going to make us show our age here. What number conference will it be for each of you?
For me, it will be probably, well, see, COVID had 1 year out. It's probably about 22 or 23. The conferences usually ran every other year. Right. So I missed the beginning ones, but I started going in 78. So.
Yeah. And I started going in 88. So I'm 5 less than she is.
Yeah.
So there you go. So quite a few.
Yeah. Yeah, we're witnesses to this. Right. I feel like I've seen the whole thing because I was very much aware of what was happening when they had the first convening of the conference. The other thing I just may want to mention too is there will be a recognition and tribute to Gebony and Lavin at the start of the conference, the first day. Just to acknowledge their presence, but also acknowledge what the contribution has meant to just something that has sustained itself for 50 years. Right. To say nothing of the leaders.
Yeah, I doubt that 2 graduate students who were sitting down trying to put together a list thought that this was going to be going on 50 years later. So that's quite a testament to what they started. And unfortunately, we lost Chris Gebby this year. So I think that some of her family may actually come to this conference because they noted that they had kind of grown up going to NANDA conferences, so they felt like they were part of the family. So
We will have random photographs taken. There will be accessibility. Thomas will be there to help people convert their computers so that they will be able to connect to the BC internet service and get their whatever they need to get access internationally, but also locally. And I don't know if people need other kinds of access, but Thomas is usually pretty good at helping all of us get information. And just to remind people who are presenting papers, all of this information has been sent, but to put their presentation on a stick, and that stick will be downloaded to a computer that will be present in every room where presentations will be held.
Yeah. So I guess I'm going to wrap up and say thanks for joining us. If you have any additional questions or comments, you can always reach out to us by email. Also wanted to just remind everybody that in March, we do have the second in a series of webinars on SNOMED CT and the importance of that linkage for NANDA International that Dr. Christine Spiesla, who's the chair of informatics, is doing. Her first one was very well received and people wanted more, so she's going to give us more. So please take a look on our website. You'll see the linkage there. That's a free webinar that you can take advantage of. So I encourage you to do so.
Just one other thing, and that is if anybody needs a visa letter as for access for travel for tourists visas, you can just request one from any one of us, but the NANDA admin will have it.
Send a note to admin@nanda.org and she can get you a letter.
They're ready, prepared. For all of you who are presenting at the conference, you've already received one letter and you probably have a second now that's coming to you. The other thing is one other thing, and that is you're going to be putting information up about awards and recommending people for awards.
Yes.
And we've been in the process of getting that together. And so you may want to say something about that.
Yeah, we do have, we will be having a call coming out first week of March, actually, for a call for awards. There are several NANDA International awards. Some are very specific, some are broader. So take a look at those and think about people in your local networks or regional networks that you think are deserving, and don't be shy and nominate people, and don't be shy to nominate yourself either.
Yeah.
The fellowships, the NANDA International Fellows do have some pretty stringent requirements. You have to be a member for 10 years, and then you have to have shown some pretty substantial contributions to the association, as well as to how you move the terminology or classification forward. But those will be coming open just about the same time. And those do have very specific requirements in terms of letters of recommendation, et cetera, but it's all detailed in the information that will go up online. And I guess the one last thing I will tell you is there's also there's going to be a really great workshop I'm very excited about in April on clinical judgment and functional health patterns by one of our distinguished Gordon Scholars, Dr. Rita Gengo, who will be doing both an English and a Portuguese version of the seminar for us. So again, take a look on that. The registration is open. Those are both in April, but make sure you are clear which one is English, which one is Portuguese, so that you register for the right one. But that should be a very nice seminar as well. So I think that does our time for today. So we'll wrap up. Thanks for joining us. And again, don't hesitate to reach out if you think about something later that we didn't answer. We'll be happy to do so for you. Have a nice time and a nice day, and we look forward to seeing you all in June.
That's right.
Take care.
Bye.
Bye.